fibrillation, or AFib, has long been linked to a higher stroke risk. The condition means the upper chamber of the heart is offbeat, often quivering instead of contracting the way it should. The danger arises if leftover blood pools in the heart, which can cause clots to form.
If the blood clot leaves the heart, the first two blood vessels that exit from the heart actually go to the brain. And so there is a risk that a stroke could ensue.
These strokes can be catastrophic and leave lasting damage, but now research is linking AFib to so-called silent strokes.
We can identify on a CAT scan or an MRI a small area of the brain that had some damage but wasn't manifest clinically. In other words, the person can't recall an event where he or she was paralyzed or couldn't speak or had a sudden difficulty, but we can identify that person did have some damage to the brain or had a stroke at one time or another.
The arrhythmia correlated with a 7.2-fold higher risk of having at least one silent stroke that showed up on an MRI. This excluded people who were already on blood thinners.
A significant percentage of people with atrial fibrillation, if studied very carefully, have had a very small silent stroke.
Up to now, AFib was linked to symptomatic stroke along with TIAs or mini strokes. This new connection to silent strokes opens discussion about putting more people on stroke-reducing blood thinners.
The bottom line is one must consult his or her physician to make certain that there is a careful analysis of the risk and the benefit in terms of therapy.
So the topic of silent stroke might be a conversation starter between you and your doctor. For Lee Memorial Health System, I'm Amy Osher.